Good afternoon. Thank you for joining me today for the CACFP at Risk annual training. I want to let everyone know that this training is being recorded and will be posted on our webpage. Since this training is an annual requirement, if you are watching the recording, you will be required to take a short quiz after this presentation as proof of participation. Everyone attending the live training today, your attendance and participation is tracked through the webinar software, so no quiz will be required. During the live presentation, if you have questions, please enter them into the question box. I will be compiling the questions after the training today, and I will send out a Q&A email to all the CACFP at-risk districts later this week. Those of you watching the recording, I will post the Q&A on the website, and if you have any questions after reviewing this training, please contact me on the email address on your screen. My name is Alyssa Mank. I am the Child and Adult Care Food Program Nutrition Consultant for the Department of Education. I have worked in child nutrition for a little over 7 years, and I specialize in the CACFP at Risk and the Pre-K program. Maine has a wonderful child nutrition team. Please feel free to reach out to any of the child nutrition staff with questions or for support. Let's get started. First, I will be discussing the legislation that was passed in 2019 called LD 577. Those of you watching the recording, if this legislation does not apply to your district or your district is an experienced CACFP sponsor, you may skip ahead in this presentation to a slide titled CACFP Meal Pattern. Those of you attending the live version today will get a quick refresher. So what is LD 577? LD 577 is titled An Act to Increase Access to Nutritious Foods in Schools by Implementing an After-School Food Program for At-Risk Students. The public law is available to view online at the link on your screen. The law states, beginning with the 2020 school year, a school administrative unit with at least one public school in which at least 50% of students qualified for free or reduced price lunch during the preceding school year shall participate in the federal child and adult care food program. So how do I know if my school district meets the 50% or more criteria? In anticipation of this question, DOE Child Nutrition annually creates a report titled LD 577 Report by District. This report shows all the schools and districts that fall under this requirement for that school year. The LD 577 status report is located on the CACFP at-risk webpage. The link to the at-risk webpage is available on your screen. It is important to note that the image of the report on your screen is an old example of the report and is not current. Please make sure to check the full report to see if any of your district schools are listed. What do we need to serve for CACFP at risk after school? The typical meals are a snack, which are 2 components, and supper, which is 5. Supper can be in unitized containers or served through a normal lunch line. It can be hot or cold, and it's a great way to serve unused items from the lunch. Schools can use offer versus serve, offer 5 components, and students must take at least 3, and $4.33 for each supper meal served. That's $4.03 reimbursement, and then 30 cents cash in lieu of commodities. Reimbursement rates are updated every July and were released this past week. The rates on your screen are effective July 1st, 2022 to June 30th, 2023. Please reach out to me by email if you have any questions about the current reimbursement rates. Districts who operate CACFP at risk can serve on snow days, school vacations, and weekends. Districts can even serve breakfast and lunch on those days with prior approval. It's important to know that snack or supper can be served as soon as the school day ends. So for an example, ABC school dismissal bell rings at 2:30, then ABC school can serve supper at 2:30. A requirement of the program is that participants need to eat their meal on site. I will be discussing any waivers currently in place at the end of this presentation. If my district meets the requirements of the law for CACFP at risk after school, but our district is already serving snacks through the after school snack service program, do we need to do anything? And the answer is yes. The district needs to either participate in CACFP at risk after school or opt out using the guidance from LD 577. Another common question we get is our district school does not offer an after-school enrichment activity. What are we required to do? So an after-school education or enrichment activity that is open to all is a requirement to participate in CACFP at risk after school. If a district or school does not provide education or enrichment activities, the district does not qualify for CACFP at risk and must opt out using the guidance from LD 577 or start an enrichment program. So what does open to all mean? Education and enrichment activities that do not limit membership for reasons other than space or security, or where applicable, licensing requirements. So this means that the football or basketball team or any sports teams really would not qualify as enrichment because it's not open to everyone every day. Examples of open to all enrichment activities are homework help, garden club, or the Lego club. So how does my district opt out? By law, a school that is required to operate a federal CACFP program may choose to not operate such a program if it determines by a vote of the governing body of the school administrative unit after notice and public hearing that operating such a program would be financially or logistically impractical. So what does this mean? This means that the school board could have a school board meeting, which allows a public hearing prior to the vote. After our district holds the public hearing and the board votes, do I need to report the results to the Department of Education? And the answer is yes. An online LD 577 opt-out form is created annually. This form requires information regarding the date of notice, the date of the public hearing, and the date of the results of the school board. The form also asks why the sponsor or district decided not to operate the CACFP program. Under LD 577, when do schools have their public hearing by? Have to have their public hearing by. Is there a deadline or a timeline? Child Nutrition Annually posts a list of qualifying schools that fall under LD 577 for that school year. Typically that's around November, depends on when the October survey results come out. The notice, the public hearing, or the school board vote needs to be completed sometime within that qualifying school year. So to recap, the qualifying district can start or opt out anytime during the qualifying school year. So a district that may want to pilot the CACFP at risk program can serve supper may want to start the program in the spring. Try it out for a few months and see how it goes. So what is the process for starting the program? First, you need to reach out to Child Nutrition via the email address on your screen and let them know that your district is interested in starting the program. You need to watch the at-risk webinar, which is what we're watching right now, and it's recorded. Then you need to send the CACFP team required information to be set up in CNP Web. This is like the names of your schools that you want to operate in. Obtain user IDs and passwords with the CACFP team. You need to complete the online agreement through CNP Web. And then once your agreement's approved, the district may claim meals from the beginning of the month in which the agreement is approved. The agreement approval process time can vary based on the number of corrections needed once it has been submitted to the state agency. The CACFP team is great about processing the agreements as quickly as possible. If you have any questions about what you just heard or need more clarification, we recognize each district and school is unique, so please reach out to us. We want to help you. Now we're going to dig into the basics about CACFP at risk. Please know all CACFP training documents are located on our webpage or by using the link on your screen. All CACFP at-risk training materials are sent out annually when your agreement is approved or upon completion of your agreement renewal. First, we're going to talk about the CACFP meal pattern. At-risk programs can operate outside school hours. This includes holidays, vacations, and snow days. At-risk sites can serve up to one meal and one snack per child per day. So an example is ABC School serves breakfast and AM snack during school vacation weeks. This is the CACFP meal pattern. In CACFP at risk, you can serve any child age 18 and younger. It's important to know that you would serve participants between the ages of 13 and 18 the same serving sizes as the 6 to 12 age group. These are minimum serving sizes. We certainly encourage your districts to serve more to the older kids as they may need more. The breakfast meal pattern includes 3 components. The first is fluid milk, fruit, a vegetable or a combination, and a grain. Breakfast may be served on school vacations, weekends, and holidays if education or enrichment activity is offered. At breakfast, fruits and vegetables are treated as a single component. So for breakfast, districts can choose to serve a vegetable, a fruit, or a combination of both. And if you wish at breakfast, you may replace the grain component with a meat or meat alternate item up to 3 times per week. Parents may provide 1 nutritionally equivalent component per day, and the district can still claim the meal for reimbursement. An important thing to remember is there is no vegetable subgroups required in the CACFP meal pattern. Districts can choose if they want to follow the CACFP meal pattern or the NSLP meal pattern requirements. The vegetable subgroups would be required for districts utilizing the National School Lunch meal pattern. Meat or meat alternates at breakfast include the flexibility to serve as part of the breakfast. And again, like I said, you can substitute the entire grain component with a meat or meat alternate breakfast a maximum of 3 times per week. It's important to know as a meat alternate that yogurt must contain no more than 23 grams of sugar per 6 ounces. This handout is available on our webpage, and it can provide you with more tips and information about replacing the grain with a meat or meat alternate item at breakfast. USDA also has a great handout regarding serving milk in the CACFP. There's a lot of great information and is a quick guide for serving milk to all ages in CACFP. On the back, it provides you a space to practice identifying the correct milk for the different age groups. Very similar to NSLP, CACFP sites must provide reasonable modifications to meals and snacks or to the meal service itself to accommodate participants with disabilities. These modifications are done on a case-by-case basis. If the meal modification required does not meet the meal pattern requirements, then a medical statement from a licensed physician or licensed healthcare professional who is authorized to write medical prescriptions under state law must be provided. Meals that do not meet the CACFP meal pattern requirements are not eligible for reimbursement unless they are supported by a medical statement. The medical statement should include a description of the child's disability so that you understand how it restricts the child's diet. The statement should also describe what must be done to accommodate the disability. This may include what food should not be served and recommendations for what should be served. A medical statement is required to justify reimbursement for the modified meal. This statement should be kept on file at the site or where the food is prepared. If the parent provides a note signed by a doctor, then you must provide the substitution. You may always choose to accommodate a non-disability related special dietary need that is not supported by a medical statement if the modification requested can be made within the meal pattern requirements. An example of this would be if a parent told you that their child cannot eat strawberries. Strawberries can be easily replaced by another fruit to meet the meal pattern requirements. Modified meals that meet the meal pattern requirements are reimbursable without a written medical statement. However, you should have a note from the parent on file so we know why the child is receiving something different from everyone else and there is no appearance of discrimination. Non-dairy beverages may be served to participants with medical or other special dietary needs. Non-dairy products that do not meet the eligibility requirements may only be claimed if there is a documented disability and the product is specifically listed on the diet modification form, which again is signed by the medical authority. Non-dairy beverages must be nutritionally equivalent to cow's milk and meet the nutritional standards listed in the manual. Non-dairy beverages may be any fat level and must be unflavored for children under the age of 6. As you'll remember, fluid milk is its own component in the CACFP, so if you cannot serve fluid cow's milk, then you need to either find a beverage that's nutritionally equivalent to cow's milk, or you need a note from a doctor if you want to receive reimbursement. The following milk substitutes do not require a diet modification form: lactose-reduced milk, or non-dairy beverages that are nutritionally equivalent to cow's milk. Remember, if a parent or guardian has a doctor's note, then you must provide the food substitute. However, you may run into a situation where a parent or guardian requests a substitute, but the child does not have a disability and they do not have a note from the doctor. It's definitely great customer service to provide the requested substitute if at all possible. If not, remember the parents can still bring in one food component and you can still claim the meal if you provide all the other food. Regardless of whether you are providing the substitute or the parents are, have the parents fill out a diet modification form and keep it on file to prevent any appearance of discrimination. The meal containing the substitute will be reimbursable if the substitute is nutritionally equivalent to the original component and meets the meal pattern requirements, and the diet modification form is on file. For example, a family might be vegetarian and want their child to receive a non-dairy beverage. It would be great customer service to purchase the non-dairy beverage if you can. Have the family fill out the diet modification form to request that their child receive a non-dairy beverage. Then refer to the list of milk substitutes mentioned in the last slide. If the non-dairy beverage that they are requesting is listed on the chart, it's nutritionally equivalent to cow's milk, so it meets meal pattern requirements, and you can serve and receive reimbursement with just the parent's note on file. If the parent insists on a non-dairy beverage that is not listed on the chart, then it is not nutritionally equivalent to cow's milk, and you cannot receive reimbursement for meals and snacks containing the substitute until you get a note from a doctor. 100% fruit or vegetable juice is creditable in the CACFP as either a fruit or a vegetable, depending on what it's made of, but you are only allowed to serve juice one time per day. This is due to juice lacking dietary fiber and other nutrients. Vegetables and fruits that are blended and served as a smoothie are considered to be juice and are included in the restriction of juice being served no more than once each day. The once per day juice restriction applies to the site, not to the individual child. So juice cannot be served at PM snack and supper, even if the snacks are being served to distinctly different groups of children. If juice is being served at two different supper shifts to two distinctly different groups of children, it can be served to both shifts because only one meal service contains juice. The meal pattern for kids for lunch and supper is made up of all five food components. Unlike breakfast, fruits and vegetables are considered different food components at lunch. There are a few rules around serving fruits and vegetables at meal times. Pureed fruits and vegetables used as part of a meal item. So an example would be pureed carrots in a sauce used for macaroni and cheese can count as a creditable vegetable as long as the dish also contains at least 1/8 of a cup of a recognizable vegetable per serving. 2 servings of different beans or peas, which are legumes, can count as a vegetable and as a meat alternate in the same meal if they are in separate dishes. For example, chickpeas may be served as part of a salad as a vegetable component, and pinto beans may be served as part of a chili as a meat alternate component. A full serving of the legumes included in each dish must be served to each child in order to claim both as a vegetable and a meat alternate component. At lunch and supper, if you have the flexibility to replace the fruit component with a second vegetable, at lunch and supper, you have the flexibility to replace the fruit component with a second vegetable if it's a different vegetable from the one you're already going to serve. This is because most children already eat enough fruit. Allowing 2 vegetables at lunch and supper increases exposure to a wider variety of vegetables. It's also important to know if seeds or nuts are served as a meat alternate, they can only credit as 50% of the portion size. Seeds or nuts must be combined with another meat or meat alternate to fulfill portion size requirements. Vegetables do not credit towards the meal pattern based on volume. Do credit towards the meal pattern based on volume. Kind of the opposite of dried fruit, raw leafy greens credit at half the volume. So for example, 1 cup of raw spinach leaves would credit as half a cup of vegetables. And in CACFP, we credit tomatoes and avocados as vegetables. So keep that in mind when you plan your menus. Here's an example. The lunch and supper meal pattern for children 6 to 18 years of age requires minimum serving sizes of a half a cup of serving of vegetables and a 1/4 cup of serving of fruit. Therefore, the serving size of the second vegetable served in place of the fruit component at lunch or supper for this age group must be at least 1/4 cup. And remember to offer 2 different vegetables. If you offered 1/2 cup of cooked carrots and 1/4 cup of raw carrots, then the meal would not meet the meal pattern and you would not be eligible to receive reimbursement for that meal. So in the example above, a supper with a serving of red peppers and a serving of carrots would be allowable. Schools may not serve 2 fruits at lunch or supper. Food items that are a mix of vegetables and fruit, such as a carrot raisin salad, can credit towards both the vegetable and fruit component at lunch and supper if each component is easily recognizable and each serving size contains at least the minimum reimbursable serving size of 1/8 cup of carrots and 1/8 cup of raisins. A child in the 6 to 12 age group would need to receive 1/2 cup of carrots and 1/8 cup of raisins, which is a dried fruit, in a serving to have the carrot raisin salad credit towards the entire vegetable and the entire fruit component. Now you may have noticed that I said 1/8 cup of raisins rather than 1/4 cup of raisins, 1/4 cup of fruit mentioned in the meal pattern. That's because dried fruit credits a little differently. Dried fruit credits towards the meal pattern at twice the volume of fresh fruit. So 1/4 cup of dried raisins credits as 1/2 cup of fruit. Another rule around serving fruits is that home canned fruits are not allowed due to the risk of botulism, but freezing your own fruit is okay. Just like the vegetable and fruit mixtures, serving 2 vegetables as part of a vegetable mixture can also credit towards the entire fruit and vegetable component if you can recognize each vegetable and each serving contains that minimum 1/8 cup serving size. Home canned vegetables are not allowed due to the risk of botulism, but like fruits, freezing your own vegetables is okay. If you buy pre-mixed vegetable mixtures like the one on your screen, they will need to credit as a single vegetable because you don't know how much of each vegetable is actually in the mixture. At snack time, you can serve any 2 of the 5 components as long as only one of the components is a beverage. It's best practice to include a fruit or vegetable as one of your snack components to encourage healthy eating. The grain component includes foods like breads, cereals, crackers, rolls, muffins, and tortillas. Major things you need to remember about grains in CACFP include that most sweetened grains are not allowed in CACFP, and that 1 grain item served each day must be whole grain rich. For CACFP, starting October 1st in 2021, grains are now measured in ounce equivalents. Schools have been measuring grains in ounce equivalents for years, and now it's the same across all child nutrition programs, which is exciting. On the CACFP resources webpage, we have a section dedicated specifically to ounce equivalent resources, including the measuring chart, which is listed on your screen. The feeding infants, if you happen to serve any infants after school, because your sites are walk-in sites. And then calculating ounce equivalents in recipes and crediting single serving packages of grains. My amazing coworker April has created and recorded a wonderful ounce equivalents webinar that takes you step by step through the process of determining ounce equivalents in CACFP. This webinar link is available on the resources webpage, and I also put the link on the slide. Let's move on to grain-based desserts. Grain-based desserts include all grain products that contain sugar, with the exception of quick breads and muffins. So for example, banana bread, pumpkin muffins, graham crackers, and animal crackers are okay. Originally, graham crackers and animal crackers were not allowed, but after listening to the feedback from providers, they added those exceptions in. So again, graham crackers, animal crackers, banana bread, or breads and muffins are okay. Common grain-based desserts that we find are granola bars, cinnamon rolls, whole grain donuts, or any type of cereal or fruit bar. These items are not allowable in CACFP and should not be served as part of the meal pattern. It is also important to know that CACFP reimbursement cannot be used to purchase grain-based desserts. USDA has created this great list that breaks down what is considered a grain-based dessert and what is not a grain-based dessert. This is a great visual reminder for your kitchen staff. So if you want to post this in the kitchen, because it is a big difference between NSLP and CACFP, just to have this visual reminder is helpful. Like I said earlier, with CACFP, 1 grain component served per day must be whole grain rich. If you plan to serve only 1 meal or snack per day in your program, the grain served at that meal or snack must be whole grain rich. On this slide is a resource created by the National CACFP Sponsors Association that we have available on our webpage. This handout shows you how to correctly identify a whole grain rich item using the rule of 3 and other methods. This resource is available on our website. In CACFP, you are required to post a date and menu for parents and children to see the wonderful food you're serving. Production records are not required for CACFP, so your menu must state all the components that you are serving specifically. Generic statements like fruit or vegetable should be updated to the actual item offered before the day of meal service. Cereals and yogurt should specifically list the types served, since there are sugar limits on those items in CACFP. The types of milk offered should be clearly represented on the menu. Here you can see the district is offering 1% white or skim chocolate milk with each meal. Another menu requirement is that you identify which daily item is whole grain or whole grain rich. You cannot write a statement on the menu that says 1 grain per day is whole grain rich. You need to identify specific items each day with the words whole grain or the letters WG or WGR. The posted menu should also include the short non-discrimination statement, which is this institution is an equal opportunity provider. Common things we find on the menu are potato chips and veggie straws. Just a reminder, these are not creditable items in the food program. Breakfast cereals, like I said, must contain no more than 6 grams of sugar per dry ounce. Breakfast cereals include ready-to-eat cereals, instant and hot cereals. So how do I determine if breakfast cereal is within the sugar limit? You can use the Maine Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC, approved breakfast cereal list. Anything listed in that resource meets the sugar limits. You can also use USDA's Team Nutrition Training Worksheet. This shows you how to compare the nutrition facts label to the chart on the form, and if it falls within the guidelines, then it is creditable. The third way is to use another handout that helps you calculate the sugar content per dry ounce. Again, this resource is available on the Team Nutrition webpage. Yogurt, like I said earlier, is another item that has a sugar limit. This is different from NSLP. So how do I determine if my yogurt is within the sugar limit? Again, USDA created this Team Nutrition Worksheet, which allows you to compare your nutrition facts label to the chart to see if it is creditable. The other is to, again, compare your nutrition facts label and then to calculate the sugar content yourself. And this worksheet helps you do it. At-risk sites must offer all 5 components at supper, and a child may decline to take 1 or 2 of the components. This is called offer versus serve. Mixed component items containing 3 or more components may not be declined. A food or component is one of the food groups that comprise a reimbursable meal, and a food item is a specific food offered within a food component. So a turkey on whole grain bread is a food item that contains 2 food components. Offer versus serve is allowed at at-risk sites. However, it is not allowed at snack time. USDA has this handout available for more information on how to implement offer versus serve. There may be times when you want to serve a homemade or pre-made combination food or mixed dish. These foods are ones in which a single serving of the food item contains 2 or more of the required food components. So common examples of combination foods are pizza, shepherd's pie, chef salads, and a hamburger on a bun with lettuce and tomatoes. To document how these foods credit towards the meal pattern, keep either a standardized recipe or documentation from the food manufacturer on file. We will ask to see these documents during administrative reviews. A see and label statement clearly identifies the contribution of a product towards the meal pattern requirements. It protects child nutrition program operators from exaggerated claims about a product. A see and label provides a warranty against audit claims if the see and labeled product is used according to the manufacturer's instructions. During an administrative review, the CACFP team will be asking to see copies of see and labels for items listed on the menus. There are a couple of great resources available for helping you determine if and how a food item credits towards the meal pattern. One of these items is USDA's Food Buying Guide. The Food Buying Guide is available online and includes many different features to help you determine if items are creditable and help you determine how much food to purchase. And they now have it available on a mobile app, which is interesting and is helpful. Another resource is USDA's newly updated crediting handbook for CACFP. This is a great resource for learning about the meal pattern and determining if foods are creditable or not. It's also helpful for school districts if you're not sure if the same rules follow through NSLP and CACFP. Having this tagged on your internet search bar to do a quick search is really helpful. Now I'm going to talk about record keeping in CACFP. Record keeping is a very significant part of CACFP. We are one of the most highly regulated child nutrition programs. So keeping accurate and complete CACFP records proves that you're eligible to receive the reimbursement. You'll hear us say a lot, if we can't see proof, we have to say it didn't happen. There are a lot of different types of records that you need to keep for CACFP, and today I'm going to go over what records you need to keep on file and where. Please try to keep your records well organized. It will save us all a lot of time and energy when we review your program. You can keep your records digitally or on paper. CACFP reviewers are transitioning back to on-site reviews starting with the 2023 school year. We will be doing a hybrid model, asking for documents to be uploaded in the e-review system and looking at other documents on-site. According to regulations, you must keep all CACFP records for 3 years plus the current year, so 4 years total. If your institution is going through an audit, certainly keep your records until the audit is closed. If your institution has a policy to keep them longer, of course, that is fine as well. The current and past year's documentation must be kept on site. The other 2 years can be kept off site if you don't have enough space to keep all 4 years on site. We give you all the different records, forms, and information that you'll need for your daily CACFP operations. CACFP sends out CACFP at-risk documentation once your agreement is approved or renewed. Most of the resources are also at the very top of the resources page of our MDOA CACFP website so that you can access them anytime that you need them. If the forms that we created for daily operations do not work well for your particular program, you are more than welcome to create your own as long as they capture all of the needed information. It will be helpful if you organize the majority of your program paperwork by month. When we audit your program, we will request to see all of your program paperwork for a specific month of operation, so having it already organized by month will be really helpful. Most school districts are now familiar with CNP Web. When you participate in CACFP, you are required to complete an agreement in CNP Web. This is an example of a CACFP agreement. In an effort to streamline the application process, school districts are not required to complete the budget or the management plan portion of the agreement. The online agreement tells the state how and where your district plans to operate the at-risk program. We consider the agreement in CNP Web as a living document because you can make changes to it throughout the year with state agency approval. It's a great reference to make sure that you are claiming the correct number of sites and participants and correct meals. Once you've completed one online agreement in CNP Web, most of the information will roll over into the following year. The district will be required to submit an agreement every year. Now I'm going to go through some of the specific record keeping requirements for different CACFP records. The first is the non-discrimination statement. The non-discrimination statement is required on all program materials that are distributed to the public that mention USDA or CACFP specifically. This includes menus, program handbooks, advertisements, press releases, or website or social media posts. USDA is very particular about the non-discrimination statement. You must use the exact wording of the statement and be careful about font size. There are two non-discrimination statements, the full statement and the short one. This is the full non-discrimination statement. As you can see, it's pretty long and it works well in bigger publications like program handbooks. This was updated May 18th of 2022. So if you haven't updated your civil rights webpage or section of your webpage, make sure you have the correct full non-discrimination statement on there. This is the short statement. Prior approval for using the short statement is required for everything except menus. You can use the short statement on menus without permission. Mentioning USDA or CACFP specifically versus saying we provide nutritious meals and snacks at no charge. So what that means that is if you're advertising your supper meal on social media, it may benefit you to say we provide nutritious meals and snacks at no charge versus saying USDA or CACFP, because if you say those, then you are required to ask permission to use the short statement. There are different record keeping requirements for different types of documentation. These are records that must be made available for public view. We will check them when we review your program. I am excited to share that the Building for the Future flyer is no longer required to be posted for CACFP at risk sites. What is required is a current dated menu and the And Justice for All poster provided by DOE. And if you need any, please put it in the question box and we will make sure that we get those to you. These are examples of unitized meals from Portland Public Schools. The first is a chicken Caesar salad. Make your own pizza and a cracker stacker. Portland uses the CACFP meal pattern. Sanford School also has utilized their mascot brand for their supper meals. So they are called the Spartan Super Snacks. They have created stickers that go on the unitized meal containers to show off their brand. Along with posting the menu in public view, the Spartan Super Snack menu is posted daily in the announcements. This is a great way to promote your program during the school year. For Portland Public Schools, meals are delivered to sites in Cambro containers to keep meals at the correct temperatures. At-risk meal service is different for every school and every district. Some use carts, some use the normal lunch line. Find a way that works best for your students and your staff. The meal service can be in the cafeteria or served from a cart. The kids can eat in the cafeteria, the classroom, on the sports field, in the library, anywhere that is considered on-site. Under typical program rules, participants can only take one component off-site. That item has to be a grain, a fruit, or a vegetable, and the school has to have some way of monitoring that flexibility. That can be posters or having your staff remind children or participants that they can only take one component off-site and which component that is allowed to be. The supper cart pictured on your screen is from a school district in Los Angeles. So they chose to brand their carts for serving supper specifically, which is really cool. In order to participate in CACFP, you are required to train your CACFP staff on 7 specific CACFP topics annually. I'm required to train you on those 7 topics, which I am doing today. Trainings that you or your staff receive outside of your organization do not count towards this requirement. So that includes today's training. You need to train your staff on exactly how to perform CACFP duties in your program. So outside trainings like today do not count towards that. Some topics relate to all staff. Some topics only relate to staff with relevant duties. You are required to keep documentation of these trainings. We can't just take your word for it. Again, you'll hear us say if we can't see it, we have to say that it didn't happen. To assist with that, we do have a form available to help you track training. It's in the list of forms that I mentioned earlier today. The form lists all the required training topics, and it has places to record the date and the location of the training, as well as places for trainers and attendees to sign. Make sure you train on topics related to staff member CACFP duties. An example is you don't need to train someone on how to take a point of service meal count if they only file the claim. We have a form available to help you track staff training, which is on your screen. If you are working with an outside entity to provide the enrichment after school, and they are the individuals responsible for meal counts and attendance, they need training. It may be in the district's best interest to have site staff responsible for these duties sign a statement that they understand the training and requirements of the CACFP program. Again, like I said, there are 7 required training topics that you must train your staff on annually. When we review your program, we'll ask to see your training documentation for all 7 of the required topics for all applicable staff. Civil rights is the first required training topic, and everyone having anything to do with CACFP needs civil rights training. We do have a civil rights presentation on our website that you can use for your in-house civil rights trainings, because civil rights procedures are the same for everyone. This is the only outside training that you can use for your in-house trainings. These are the other 6 required topics. Please remember, I'm talking about in-house training, not trainings you receive from us at the state or elsewhere. For each of these 6 topics, you will annually train staff with related duties on how you meet these program requirements within your organization. You will train your staff on your organization's procedures for meeting the requirements. We can't help you with these trainings because we don't know exactly how you do things in your district. For example, in some programs, point of service meal counts are taken by teachers. In other programs, the cook may be in charge of the point of service meal counts. Every program is a little bit different, so you need to train your staff on your specific procedures. We touched on it briefly earlier, but it's imperative that you keep any doctor notes or parental requests on file regarding food substitutions. If the food substitution results in you not meeting the meal pattern, you must have a doctor's note on file if you plan to claim the meal or snack. If it's a parental request you can still meet the meal pattern with the food to be substituted, keeping these notes prevents any appearance of discrimination if a child is not eating the same food as everyone else. We will ask about these notes when we review your program. You also need to keep point of service meal count records. Point of service means that you're taking these counts of meals served immediately before, during, or immediately after the meal service. Most CACFP programs require meal counts to be taken per child at point of service. Some programs have a sheet of paper with a list of kids' names and columns for each meal and snack. They make a check mark next to each child's name when they are served each meal or snack. We included a sample meal count form and the list of forms on our website that I mentioned earlier. You're welcome to use this meal count form, or you can create your own, as long as it captures all of the needed information. Some businesses or school districts purchase computer software that captures their meal counts. Either method is okay. At-risk after-school programs may take consolidated meal counts, which are just a total of meal counts or of meals served rather than doing it by children's names. Attendance records are another CACFP requirement. Attendance must capture the individual's first and last name. Just to be clear, this is attendance at the meal, not attendance at the enrichment program. Meal count should never be higher than attendance, so attendance records make a great edit check to ensure that you are not overclaiming meals and snacks. It's a built-in edit check when compiling meal counts and attendance for the claim. USDA likes to see 2 sets of eyes on all program paperwork to ensure accuracy whenever possible. Some districts are using their point of service keypad system as attendance, as it links to a child's name, and they are using a tick sheet similar to the ones used in summer for the meal count. All districts currently operating in the program do it differently. Make sure you do what works for your school. Accountability is key. Districts cannot claim more meals than participants in attendance. This is something that needs to be discussed when partnering with outside organizations. The district is ultimately responsible if numbers are incorrect. This is a meal count form that is available on our website. It gives space for a participant to write their first and last name, a check mark for attendance, and a check mark for the meal. Again, all at-risk sites meet these requirements differently. Do what works best for you and your sites. Monitoring and 5-day reconciliations are required for institutions with more than one site, and they help ensure program integrity. This form is available on our website, but is also sent out annually to at-risk sites upon agreement approval or renewal. The district is required to review each site 3 times per year. 2 of the 3 visits must be unannounced. At least one of the unannounced visits must include a meal service observation, and new sites must be monitored within the first 4 weeks of operation. We provide monitoring forms for you, which outline everything you need to observe and record. Again, 3 monitoring visits per agreement year. 2 visits must be unannounced. 1 unannounced visit must include meal service observation. Make sure to vary meal services observed. If you are serving suppers, evening snacks, or serving meals on the weekends, make sure to observe those as well. Please make sure to complete the 5-day reconciliation form at each monitoring visit. If you start a new site, the site again must be visited within the first 4 weeks of operation. The purpose of a 5-day reconciliation is to reconcile meal counts to attendance. It determines if meal counts are reasonable. It highlights discrepancies in meal counts and attendance, and ensures that license capacity or capacity of the site is being followed. This process allows us to look at a week's worth of attendance and meal counts to make sure things look okay. This document is again available on our webpage. USDA has issued the attached Q&A memo to answer questions regarding the annual collection of race and ethnicity data. Although CACFP institutions are no longer allowed to make visual observation of race and ethnicity, the data must still be collected once each year. Districts that collect meal benefit applications should make every effort to help parents understand the reason for the data collection and encourage them to complete the race and ethnicity portions of the form. The attached memo provides some links to school data and census data websites, which institutions that do not collect race and ethnicity data through the meal benefit applications can use to collect the data for their area in which their sites are located. Those districts should utilize the links to collect this data every year, unless you're already collecting that data at your site. USDA expects institutions that collect data for other purposes and programs to gather the data from those programs and keep it in their CACFP files. The memo specifies that USDA encourages institutions that do not collect enrollment forms to ask parents to verbally identify the race and ethnicity of their children, and that USDA discourages asking children to self-identify. Please read the memo carefully. USDA expects a specific conversation to take place if the institution asks a parent to identify the race and ethnicity of their children. If parents rarely come into the site, or if the conversation is uncomfortable, please feel free to use the data that can be found through the provided links for the school or census data. If an institution uses the data found on the school data or census websites, please be sure to print or otherwise document that data and keep it in your CACFP records. Schools that sponsor CACFP at-risk sites can use the race and ethnicity data that is collected for the school in which they are operating the at-risk program. Claims for reimbursement. District completes and submits their claim for reimbursements to DOE monthly within CNP Web. You are going to keep monthly claim information on file along with supporting documentation. When you're filing a claim, it's important to remember that each claim applies to a single calendar month. So for an example, February 1st to February 28th, even if that month ends in the middle of a week, make sure your other supporting documents reflect that as well. At-risk after-school programs receive the free rate of reimbursement for all meals and snacks served. These rates include the new rates, which are released every year, plus an additional 10 cents for each meal and snack that was authorized by the Keep Kids Fed Act for the 2022-23 year. Please keep in mind when rates are released next year, it will probably falsely appear that the rates have decreased because the extra 10 cents will not be included for the 2023-2024 year. CIL stands for cash in lieu. This is extra reimbursement money that you will receive for every lunch and supper served that meets the meal pattern. So for every free lunch and supper you serve, you'll actually get $4.33 in reimbursement. This is a screenshot of a site claim for a for-profit childcare center in our online claiming system. We've had a lot of folks tell us that they really like the new claiming system. This is the information that you'll be entering each month for each of your sites. At-risk programs enter the number of kids that participated in the month in the free section, as they get the free rate of reimbursement for all participants. You'll enter the number of days you operated. That's the number of days that you were open for enrichment and fed kids at least one meal or snack through CACFP. You'll enter the total monthly attendance, which I'll explain in the next slide. And next you'll enter the total meal counts for the month. There are a couple more steps involved in submitting your claim payment, but we have directions for filing claims in the new system and are here anytime for assistance when you need it. As I mentioned, you'll be required to report your total monthly attendance in our online claim filing system. This is how you calculate your total monthly attendance. At the end of each day, you'll count the number of unique kids that attended your site using the attendance roster. At the end of the month, you'll add up all the daily totals to calculate your total monthly attendance. The payment system has edit checks in place to ensure that we are paying you based upon what you're approved for in your agreement. If you try to claim more than what's in your approved agreement, the system will give you an error message, and the system will not pay a claim that has errors. When you claim, you cannot claim for more kids than you're reported as being enrolled in your program. Since you are an open site, this is your best guess you made regarding the maximum amount of kids you could serve at one time. If your program has potential to serve more kids than your best guess, say there's an event happening at the school during the same time as your CACFP at risk program or supper time, make sure you increase that amount for the month you plan to serve those additional kids. Also, you cannot claim meals for any meals or snacks that you are not approved to serve, and you cannot claim for any months that you said you would be closed. That's why it's so important to make sure that the info in your agreement is always current and correct. Also, if you're going to go in to update your agreement, the system also looks at your sanitation and fire inspection dates and will not allow me to approve agreements if those dates have expired. We've been working around that process due to delays because of COVID, but please make sure your agreement is updated with any changes. Please know that when you make any changes to your agreement, such as you increase the number of kids enrolled or attending, we need to approve that change before you'll be able to file a claim for that change in the system. We can reimburse the district for changes in the month that you report the change and going forward, but we cannot reimburse the district for changes in the past. For example, let's say you revise your agreement on February 8th to increase your enrollment from 100 kids to 110 kids, and we approve the increase on February 9th. I can process your February claim for up to 110 kids, but I wouldn't process your January claim or any month prior to February with 110 kids. Only the 100 because only 100 kids because that's all that you were approved to serve in January and before that. If you have any questions about that, feel free to give me a call. It kind of sounds confusing. Claims must be entered into the system and must be in pending approval status on or before 60 days after the last day of the claim month. For example, November's claim must be submitted on or before January 29th. The system does display the claim due dates for you, so you'll always know when the claims are due. There are some exceptions. Institutions are only allowed one exception to this rule once every 3 years. Submission of claims past the 60-day deadline are only allowed with prior approval from the state agency and require that you write a corrective action plan, which you will implement to prevent future late claims. If you have any questions regarding your claims, Jody Truman is our contact, and she is the one that approves claims in CNPWIP. So feel free to reach out to Jody at any time. A common question that we get is, can the at-risk after-school program continue to operate in the summer months after schools close for summer vacation? So for example, if a school officially ends school year 2022 and 2023 on May 31st, Can the school continue to operate CACFP at risk until June 30th? And the answer is no. Experienced sponsors are already aware that under federal regulations, CACFP and Summer Food Service Program cannot operate at the same time. Whenever your school year ends, so must CACFP. Schools are encouraged to transition into the Summer Food Service Program during the summer, and CACFP at risk can pick up again back in the fall. The CACFP team has created a waiver request form for the following food program operation waivers, which will be available shortly on the CACFP webpage. Per USDA, sponsors must only implement these waiver flexibilities when congregate meal service is limited by COVID-19 pandemic. By using the CACFP food program operation waivers, the sponsor will agree to the following terms. Congregate meal service will resume once it's able to do so, and all attempts should be made to safely maintain typical CACFP operations. There is a plan in place to ensure that both proper accountability and program integrity are maintained. And if the parent guardian meal pickup waiver is requested, there are processes in place to ensure that meals are distributed only to parents or guardians of eligible children. It's important to know that waivers will not be approved for the entire length of the waiver effective date. You will need to resubmit waiver requests as needed. Under program regulations, as we discussed earlier, CACFP sponsoring organizations must review each facility 3 times each year. At least 2 of the 3 reviews must be unannounced. At least 1 of the unannounced reviews must include observation of the meal service, and at least one of the reviews must be made during each new facility's first 4 weeks of operation. And again, no more than 6 months may elapse between reviews. However, FNS recognizes that the country continues to respond to COVID-19. On-site monitoring may not be possible. Therefore, FNS is waiving the requirement that CACFP monitoring must be conducted on site. Please note, to ensure program integrity during the time, CACFP sponsoring organizations that elect to use the waiver should continue monitoring activities of program operations offsite, so through a desk audit or virtually. Typically, this is not common for schools because if they are open and operating, meals are being consumed on site. However, this CACFP waiver flexibility is available to you if you need it. A waiver form will be created for this waiver, and it can be approved for the entire effective date of the waiver. This will be located on the CACFP webpage by the end of this week. Thank you again for attending the training today. Those attending the live version, you will receive certificates of attendance. If you have any questions, please feel free to type them into the question box, and I will send them out later this week via email. And as always, please don't hesitate to reach out to our office directly with any questions. Those of you watching the recorded version of this presentation should go back to the CACFP at-risk webpage and complete the at-risk 101 quiz. This tracks your participation for this annual training. No certificates will be sent out to those watching the recording. Please document your time and attendance after viewing this webinar and keep that documentation in your CACFP files. As a reminder, attending this training today does not meet the requirement for in-house training. You are required to train your district staff on the 7 required training topics. Thanks again for coming. I hope you all are having a great summer, and talk to you soon.